Right then, this is cognitive treatments for depression. So we're looking at cognitive behavioural therapy, basically, and what that involves, which you may know something about already from your study of the cognitive approach. But we're going to look about specifically how it's used for depression. So it is used for other illnesses as well, as you're probably aware, but it's the most commonly used treatment for depression itself. And it uses both behavioural and cognitive techniques. It's about making the patient aware of the relationship between thought, emotion and actions, because as you know, those are really closely linked and affect each other. So it's about helping people to change how they think and what they do, which helps them to feel better. So here's some examples of what you might talk about in cognitive behavioural therapy. How you think about yourself, how what you do affects your thoughts and feelings, challenging negative thoughts, and behavioural techniques. It helps to break that vicious circle that we looked at before, and it focuses on here and now problems. So if you think about the psychodynamic theory, you've obviously got the stereotype of a patient sitting on a couch and Freud saying, "Tell me about your childhood." It's not like that. It's a lot more about let's look for ways to improve people's state of mind right now, rather than looking for kind of roots of problems in the past. It focuses on here and now. What can we do to make you feel better? And it's about changing parts of that sequence and get them to a point where they can tackle their own problems. So it kind of teaches techniques that they can then apply in the future as well. So it would involve between 5 and 20 weekly or fortnightly sessions, lasting half an hour to an hour. I know that some people now do get some cognitive therapy over the phone, actually. I think that's possible too. But basically what happens is you assess the patient to start with. You then would build up goals and build up an idea of what you want to achieve, set goals and targets. Then you move into treatment. They're given homework and they're monitored, and this cycle repeats for a while, and then eventually treatment is complete. Most people draw on techniques used, influenced both by Beck and Ellis. Some work with one or the other, and we're going to look at at which techniques link with which now. So Beck's therapy was looking at that negative triad, and how can we challenge that negative triad in the client and get them to stop believing it, almost. So first you assess the client to see how severe their condition is rather, and then it's like about establishing a baseline or a starting point before treatment starts to help monitor improvement. And the therapist needs to make the client aware of the relationship between thought and emotion. So if you tell yourself, "I am stupid," then it makes you feel sad, for example. So you then don't enjoy yourself. So there you go. That's one example. There's loads of examples. So that's your baseline. And then what happens is you have to learn to think positively. So you have to, the patient has to provide information about how they perceive themselves, the future and the world, as you remember, the negative triad. And then you go through a process of reality testing. So if the client says, "I always fail," that's challenged, and they have to provide an example of some time when they've been successful at something, which pretty much everyone has got an example of that. The therapist might ask the client to do something to demonstrate their ability to succeed. So that's another example of what they might do. So it's about challenging those beliefs associated with the negative triad. So the idea is that you replace those irrational ideas and beliefs with more rational ones and more optimistic ones. Right, and then if we have a look at Ellis's behavioural therapy, cognitive behavioural therapy, called REBT, which stands for Rational Emotive Behaviour Therapy. So it extends your ABC model, which, as you know, activating event, beliefs about the event, and the emotional consequences, to an ABCDE model. Disputations to challenge irrational beliefs. Disputations is quite a word, isn't it? It just means arguments. But obviously that wouldn't have fitted within a nice alphabetical model. So you think about, you dispute with the patient, and then effective new beliefs replace the irrational ones. So that's the idea. So yeah, you dispute or challenge the thoughts, and you see an effect on thought and behaviour. So the idea is to identify and dispute the patient's irrational thoughts. You can hopefully see some similarity of technique here, although they've got like a slightly different focus. You can see some similarity and see why maybe some psychiatrists use elements of both. So Ellis argues that irrational thoughts are the main cause of our distress and depression, and so it's based on the idea that when we become upset, it's not the events taking place in our lives that upset us, it's the beliefs that we hold about them that cause us to be upset. So two people, for example, might go through the exact same event, like let's imagine two sisters and their mum dies or something. If one of them holds irrational beliefs relating to herself and the world, the fact that her mum has died will trigger those irrational beliefs, and it will be a really different experience compared to her sister, who perhaps doesn't hold those irrational beliefs. So Ellis believed that irrational beliefs make impossible demands on the individual, leading to anxiety, failure, and psychological difficulty. And what he does in his techniques is challenges the client to prove these statements and then replace them with realistic ones. So here are the most common faulty beliefs experienced by people with mental health problems. You can scan down those. It's quite interesting. Not just depression, these are more wide beliefs. Faulty cognitions. And that is the end of our AO1. So please have a look at your textbook for this particular bit. Have a quick read. We're just doing the AO1 in this video, and then in the lesson we'll work on our evaluation.